of the tongue. The tongue is a mass of striated or skeletal muscle covered with mucous membrane. A median fibrous septum divides the tongue into right and left halves. Muscles attach the tongue to the styloid process and the soft palate above, and to the mandible and the hyoid bone below. A V-shaped sulcus called the sulcus terminalis, highlighted in green, divides the mucous membrane of the upper surface of the tongue into the anterior 2/3 or the oral part and the posterior 1/3 or the pharyngeal part. The apex of this sulcus projects backward and is marked by a small pit called the foramen cecum, which is an embryonic remnant and marks the site of the upper end of the thyroglossal duct. 3 types of papillae are present on the upper surface of the anterior 2/3 of the tongue: the filiform papillae, the fungiform papillae, and the vallate papillae. The large vallate papillae lie alongside the sulcus terminalis, and that's how we can identify them. The mucous membrane covering the posterior part of the tongue has no papillae, but is rough due to underlying lymph nodules, which is called the lingual tonsil. In the midline anteriorly, the undersurface of the tongue is connected to the floor of the mouth by a fold of mucous membrane called the lingual frenulum. On the lateral side of the frenulum is the deep lingual vein. Lateral to this, the mucous membrane forms a fringed fold called the plica fimbriata. The hypoglossal nerve, which is the 12th cranial nerve, supplies all the tongue muscles except one, which is the palatoglossus, which is supplied by vagus fibers in the pharyngeal plexus. The tongue has intrinsic and extrinsic muscles. Intrinsic muscles are not connected to bone. They change the shape of the tongue. There are longitudinal, transverse, and vertical muscle fibers. They originate from the submucosa and median septum and insert into the mucous membrane. Extrinsic muscles are genioglossus, hyoglossus, styloglossus, and palatoglossus. Genioglossus arises from the superior genial spine of the mandible, and that's why its name. Hyoglossus arises from the hyoid bone. Styloglossus arises from the styloid process of the temporal bone, and the palatoglossus arises from the palatine aponeurosis. The genioglossus protrudes the tongue out. The hyoglossus depresses the tongue, and the other 2 muscles pull the tongue upward and backward. All the muscles blend with other tongue muscles to insert themselves. The blood supply of the tongue. Arterial supply is from the lingual artery, the tonsillar branch of the facial artery, and the ascending pharyngeal artery. The veins drain into the internal jugular vein. Nerve connections. The posterior third is supplied by the 9th cranial nerve for general sensation and taste. The anterior 2/3, the lingual branch of the mandibular division of the 5th cranial nerve, is for general sensation, and the chorda tympani branch of the 7th cranial nerve is for taste. Lymphatic drainage. The posterior third drains into the deep cervical lymph nodes. The sides of the anterior 2/3 drain into the submandibular and the deep cervical nodes. The tip of the tongue drains into the submental lymph nodes.